I'm Dr. Leibovitz, your Central Indiana go-to foot doc. In this video, we're going to talk about kids' heel pain, the real cause, which is Sever's disease, and how to fix it fast. If you learned something from the video, please hit the like button. If you have trouble sleeping tonight and want more videos that put you to sleep, hit the subscribe button. This is the kids' version of heel pain, and you're going to see it with really active kids, the ages of between 8 and 12. About 20% of kids will suffer from this, so if you have a team of about 15, you're going to see about 3 of the kids limping around at the end of practice. What you want to watch out for is peripheral heel pain. If you squeeze the back of the heel and the sides of the heel, it's going to make them jump out of their skins. You'll see these kids run and they just can't stop real quick. They'll have to take a couple extra steps because they don't want to make impact with the heel. They tend to be toe walkers, especially in the morning, just to type of relieve the tightness in the back of the heel. And the classic, the most common sign is limping after activity, especially at the end of the season when those fields become kind of concrete and dried out. One of the most frequently asked questions about this is, why does my child have heel pain after sports? You see them playing like a hurricane, practice ends, game ends, they're congratulating each other team, next thing you know, you're carrying them off the field. Well, this is called postkinetic dyskinesia. It means pain after rest. I love saying that, it kind of flows off your tongue. Any soft tissue is more flexible when it's warm. When you stop activity, it cools down and it becomes more aggressive, and that's when you're going to see the symptoms. And that's true of any soft tissue inflammatory process, not just kids' heel pain. Now, the cause is an active growth plate in the back of the heel. This will be forming growth for girls till around the age of 12 to 13, for guys around 13 to 14. And it's normal. If you see it on an x-ray, it looks like a nice little curved line. After it's been aggravated for a while, that will change and you'll see kind of fragmentations in it, or it looks like a rat's been chewing on the area. So think of it as a tug of war. You have the Achilles tendon pulling upward, you have the plantar fascia aggravated by pronation pulling forward, and it compresses that growth plate right into the calcaneus or heel bone. Think of it as two strong lines of tug of war. Instead of pulling in a linear fashion, one bends around the corner and they keep pulling, it just forces pressure right on that corner. So it's a matter of compression between the Achilles tendon and the flat foot. Your child's pain is not growing pains. It's Sever's disease. It's a growth plate irritation. It's not a matter of growth, it's a matter of activity and compression. Typical temporary treatments for this is ice, compression, rest, massage, NSAIDs, topicals, and those are fine for the moment, but they're not going to make a whole big difference the next day, next week for helping this improve. The appropriate treatment is addressing the biomechanics, as controlling pronation, addressing the equinus or tight Achilles tendon with flexibility, and the kid's flexibility is amazing. Within 10 to 14 days, we're going to get measurable changes. For an adult, it's going to be 4 to 6 weeks to give type of a comparison. So collagen is truly wasted on youth. Shoe selection is really not what you think. Most people want to go to a very soft shoe, a pillow shoe. Not the case. We want to really control pronation, and that's a very solid back of the heel. We'll have a link to a video that will better explain that at the end. There's really no more off-season for kids. There's no more recovery time, so they're from the same sport to all-stars to another sport, and it just continually aggravates. Does this have to be treated? Well, not necessarily, but it's not going to improve the comfort. They will outgrow it when they get to the appropriate age. You know, guys around 14, 13, girls around 12 to 13, but they're going to have continued distress until that point. Many times that leads to a decrease or a cessation of activity. This also will present as the adult, same cause, the pronation and tight Achilles tendon, is plantar fasciitis in the adult. Instead, that's heel pain on the bottom, not the peripheral area. So it's pretty easy to treat in the early stages, and many times it can really help address the problems later on in life. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.